It used to be thought that when a person has a thyroidectomy, giving them back levothyroxine would completely replace the thyroid hormones that were missing when the person had their thyroid removed. In fact, some people even called levothyroxine therapy a thyroid transplant. But we now know that there are some patients, not all by any means, but some patients who, despite having normal thyroid function tests, blood tests, still do not feel normal. They don't feel the way they did before they had their thyroid removed. Now, why would that be? And there are many explanations for this. One is a simple one. They've had thyroid cancer, they may be depressed, or they've had surgery and they may be tired and having complications from that. They may now be on a medication that they were not on before. So there are many reasons that a person may not be feeling exactly the way they were before. But it's also possible that the medication is in fact not a thyroid transplant, that even though the blood tests seem to be normal, there may be other things that the thyroid gland produces that are not present in exactly normal concentrations in that patient's blood. And the thing that people have focused on mostly is another hormone called T3. So in a normal person, T4, levothyroxine, is converted into T3. But it may be that there's a subset of people that do not convert T4 into T3 as efficiently as the average person. And so there's a thought now that there are some people who might benefit from a combination of T4 plus T3 therapy. This is, again, a very small minority of people because most people feel okay. But a small subset, maybe 10, 15% of people may benefit from a combination of these two hormones. The problem is that it's difficult to give T3 therapy to people because it has a very short half-life in the blood. So it has to be given at least 2 or 3 times a day. So it's more complicated. Plus it means giving a person 2 different medications. And so this has not been generally accepted by the medical community. I think for most patients, the traditional tablets are satisfactory, but there is a small group of people who, for one reason or another, do not absorb the tablet promptly and efficiently. Many people have lack of acid in their stomach. Elderly people have something called atrophic gastritis, so they do not make enough acid. And there are just other unknown reasons that people do not absorb the medication. And for these people, it's been shown in several studies that the newer formulations, either a liquid or a soft gel, seems to be better. Also, there is some newer data to show that there's less variability in thyroid function tests in people who take these other newer preparations compared to the tablet. But I think for the average person, the tablet still is going to be satisfactory. But if there's a problem with the absorption of the medication or variability in thyroid hormone levels, then a clinician should think of using one of these other preparations.